I've lost count of how many times a dying patient has told me they saw someone who already died. A mother, a husband, a brother, sometimes someone they hadn't spoken to in about 30 years. Hospice nurses will tell you about the body, the breathing, the circulation, the physical work of dying. That's their expertise, and it matters. This is the part I see. This is what a chaplain gets called in the room for. Somewhere in the last days or weeks, the person starts talking to someone who isn't there. It's rarely dramatic. It's usually quiet. They look toward the corner of the room or past your shoulder. Sometimes they reach out. Sometimes they'll carry on half a conversation and then come back to you like nothing happened. Very often, it's about travel, packing, a trip, waiting for a ride. Is the car here yet? I need to get my things together. I've heard some version of that so many times that I notice when a family mentions it. And here's the part that surprises people the most. It's almost always calm. Sometimes it's the calmest the person has been in weeks. Whatever is happening, most people do not appear frightened by it. Now let me be straight with you about what I know and what I don't know. There are medical explanations for some of this. Changes in oxygen, organ function, medication, fever. Those are real, and I'm not going to pretend they aren't. There are also plenty of cases that don't map neatly onto those. Explanations. People who are lucid, oriented, or on minimal medication, and describing this clearly. It's usually peaceful, and in my experience, it tends to reduce a person's fear rather than increase it. So how do I handle it in the room? I don't argue. That's the first thing. If a woman tells me her mother is sitting in the chair by the window, I'm not going to inform her that her mother has been dead for 40 years. What would that accomplish? I'd be correcting someone's peace to protect my own certainty. I ask questions instead. What's she doing? Does she say anything? How do you feel when she's here? That last question is the one that matters most. Because if the answer is calm, and it usually is, then something good is happening. And my job is to not interrupt that. I'll say this plainly. I'm not in the room to explain the experience. I'm there to make sure the person isn't alone inside it. Here's what I'd tell you as a family member. Don't panic. It's not automatically a medical emergency, and it's not automatically a sign that your loved one has lost it. Don't correct them. There's very little to gain and quite a lot to lose. Do mention it to the hospice team, not because it's an emergency, but because sudden confusion can occasionally have a treatable cause, and the nurse should know what's going on. There's a difference between the calm, oriented experience I'm describing and true agitation or delirium, and the clinical team can help you tell them apart. And do listen. Ask gently. You may hear something that matters, including the second thing I want to talk about: unfinished business. Because sometimes what a person is working through at the end isn't a vision, it's a loose end. I've watched patients hold on for days past everything the body could reasonably do until a specific person walked through the door. I've watched someone let go inside an hour of hearing a son say, "It's okay, Dad, we're gonna be all right." And I've watched the opposite. Someone who is physically comfortable, well managed, and still visibly unable to rest until something got said out loud that had been sitting unsaid for 40 years. If your loved one seems to be holding on and nobody can explain why, it's worth asking gently, is there something you're waiting for? Is there something you need to say to somebody? Is something weighing on you? Sometimes that's the peace that lets them rest. And then there is one nobody can explain. A person holds on for a week. Family sits vigil in shifts. Someone's at the bedside every hour around the clock. And then everyone steps out at once for 10 minutes and gets coffee. And that's when it happens. Every single person who does this work has seen this repeatedly, far past the point where I'm comfortable calling it coincidence. I don't have a mechanism for you. My working theory after a number of years is that some people need to spare the people they love that exact moment. That protecting you is the last thing they do. I'm telling you this for one reason. If it happened to your family, if you left the room for 10 minutes after 7 days and you have guilt, you have carried guilt about that ever since, I want you to consider that it may not have been a failure on your part at all. It may have been the point. Let me close with this. I'm not asking you to believe anything. I've told you where the evidence is thin and where my own certainty runs out. But I've been in a lot of rooms, and what I've seen has made me far less afraid of this than I used to be. If someone you love describes something like this in their final days, don't argue, don't panic, just listen. You're not going to explain it, neither am I. You can still be there for it. New videos come out every week. Subscribe if this has been useful, and I'll see you in the next one.